Namaste, I am Dr. Nikita Agrawal. I am a prosthodontist and an implantologist, and my work basically focuses on full mouth rehabilitation, digital dentistry, dental implants, advanced restorative work with smile makeover. And at Studio Dentale, we are focused on using the latest digital technology and using personalized care to bring the outcomes for the patients. So a typical day at our clinic usually starts with a huddle run, a morning huddle run in the morning, where we discuss what we would like to do for the patients, which are the patients who's supposed to do what, planning the whole day. It's like a quick 15-minute huddle run that we do in the morning. That's followed by the patients who are scheduled and doing their appointments, their work, followed by spending some time in the dental laboratory to also see how we are manufacturing what is needed for their work. So oral posture is very important in maintaining your facial appearance. I think the most important thing is understanding the tongue position and keeping the tongue in a relaxed position instead of having things like tongue thrusting. So when we have tongue thrusting, then usually the teeth can flare up. Other than that, something that we need to focus on are things like mouth breathing, and also ensuring that if there are children or young kids, not doing things like thumb sucking or nail biting. These kind of habits, if they are avoided, they help in having a better dental position and also help in the overall facial appearance. So we usually think that only sweet things can affect the teeth, and many patients, they get surprised when we tell them that the acidic food, even things like lemon, dere acharharu khanu, or vinegar, or even Coke, Fanta or acidic related food haruले पनि हाम्रो दाँतलाई एकदमै affect गरिरा हुन्छ. Yes, so instead I think the most important thing for our oral cavity is, I always tell the patients, is to stay hydrated. So the most magical thing is to have water, because that water ensures that we have enough saliva in the mouth, and the more the saliva, the better in the mouth. Other thing is also switching to healthier options and not having very colored things like tea, coffee. I think that's a fantastic question, and a lot of patients ask us that whether should we go for electric or manual. तपाईले मलाई सोध्नु भयो भने, being a dentist, मेरो personal choice चाहिँ नि manual नै हो, because obviously I'm good with the technique, I know the timing. तर सबैलाई त्यो vibration, त्यो motion constantly गर्न गाह्रो हुन सक्छ. Plus timer लाई match गर्न पनि कहिलेकाहीँ गाह्रो हुन्छ. I always ask my patients, did you brush for more than 30 seconds today? Right? I mean, think to yourself that did you actually brush for more than 30 seconds? So त्यस्तो सिचुएसनमा इलेक्ट्रिक गर्दा के हुन्छ भने, त्यसको oscillations, त्यसको टाइमिङ, त्यसको भाइब्रेसनहरू सबै मिलेर नै बसेको हुन्छ, टाइमिङहरू पनि मिलेर बसेको हुन्छ. So definitely electric is a good option, but if you're doing it in the right way and the technique, even manual is excellent. Out of all the habits जुन मैले सबै भिडियोमा पनि भनिरहेको छु, दिनको 2 मिनेट 2 चोटि ब्रश आफ्नै लागि, which means make sure you're brushing your teeth twice a day for 2 minutes every day. Number 1. Number 2, remember that you also need to clean between the teeth, in between the teeth, and त्यो गर्नलाई चाहिँ नि floss use गर्नै पर्छ. So you can either use a threaded floss, you can use a water flosser, you can use interdental brush, whatever you would like. Number 3, and another very important thing which I say is that हामी जसरी bathroom गइसकेपछि every time हामी flush गर्छौं, similarly our mouth is a window to the body and it affects the overall health. So make sure that after you eat anything, rinse your mouth after every meal is what I always tell. जति मजाले बेसमारी ब्रश गर्नुभयो भने दाँत त्यति नै सफा भएर जान्छ. नो, द्याट्स अ मिथ. किन भन्दाखेरि हार्ड ब्रशिङले हाम्रो दाँत झनै खिएर जान्छ. So the myth is to make sure that you have a controlled motion for your brushing. 3 to 4 months at least. Remember to clean your tongue, because your breath, for good breath, it's very important to have a clean tongue. So tongue cleaning is equally important as important it is to clean your teeth. Ice chewing, absolutely no. Don't do that, because you are inviting cracks on the tooth. For sensitive teeth, I would say that you can start by using anti-sensitive toothpaste. तर त्यसलाई धेरै लामो समयसम्म इग्नोर नगर्नुहोस्. सेन्सिटिभिटी कन्टिन्युस नै भइरहेछ भने आफ्टर डेन्टिस्टकोमा गएर जाँच गर्न नबिर्सिनुहोस्. We often tend to ignore the oral health, and oral health is a reflection of your general health. It's a window to your body. So taking care of your oral health is extremely important. You get your teeth only twice, so 2 chances, milk tooth and permanent tooth. After that, you are responsible for it.